Hello everyone and welcome back to our channel. I am Samiksha Kaurav, a proud member at Shivi Forensics, came up with the most important 10 MCQ questions from the Forensic Toxicology, Pharmacology of Drugs. So let's begin with our very first MCQ, that is, which phase of pharmacokinetics involves the biotransformation of a drug into metabolites? The correct answer is metabolism. Metabolism is the process where the body chemically changes the drug into metabolites, and most of this happens in the liver mainly to make the drug easier to eliminate. The next MCQ is the term half life of a drug refers to, and the correct answer is time required for plasma concentration to reduce by 50%. Coming upon MCQ 3, which neurotransmitter is most commonly associated with the reward pathway and drug addiction? The correct answer is dopamine. Dopamine is called the reward chemical of the brain. As drugs increase dopamine, it creates pleasure and leads to addiction. MCQ 4 says which of the following is classified as a CNS depressant? The correct answer is alcohol. Alcohol slows down brain and nervous system activity and which causes slow reaction, sleepiness, poor coordination, so it is a CNS depressant. Coming upon MCQ 5, which says morphine primarily acts on which receptors? The correct answer is opioid receptors. Morphine as works by binding to opioid receptors in the brain and spinal cord, which blocks pain signals and produces pain relief and euphoria. Now, which biological specimen is most useful for detecting long term drug abuse? The correct answer is hair. Hair is the best because drugs get deposited in hair as it grows, so it can show drug use for weeks to months, unlike blood or urine. Coming upon MCQ 7, the primary psychoactive constituent of cannabis is, the correct answer is THC. THC means tetrahydrocannabinol is the chemical that causes the high effect. It affects brain receptors and changes moods and perception. Coming upon our next question, which analytical technique is considered the gold standard for confirmatory drug analysis in forensic toxicology? The correct answer is GCMS. Gas chromatography, which separates chemicals, and mass spectrometry, which identifies them. It is highly accurate, so it is called the gold standard. Now, the next question is a drug producing tolerance requires. The correct answer is option C, higher doses to achieve the same effect. Because with repeated use, the body becomes less sensitive to the drug, so the same dose gives less effect and it leads to higher dose is needed. The last and most confusing question. Which schedule of pharmacokinetics is represented by the acronym ADME? Which is absorption, distribution, metabolism, and excretion. This is the full journey of a drug in the body. Absorption, which enters body, distribution, where it spreads, metabolism, where it breaks down, and excretion, where it is removed. So that's it for all today. We have learned some very important MCQs from forensic toxicology and pharmacology of drugs. We understood how drugs move in the body through ADME, what half-life means and why it is important, the role of dopamine and addiction, CNS depressants and opioids, important forensic samples like hair, blood, urine and saliva, and also the importance of GCMS as the gold standard test. These concepts are very important for exams as well as for understanding real forensic investigations. Make sure you revise these MCQs again and again because they are commonly asked in exams. Thank you for your attention and thank you for watching.